So I'll be presenting updated data of our ongoing study of hyper-CVAD plus Blinatumomab in patients with newly diagnosed Philadelphia chromosome negative B-cell ALL. We're also showing the added benefit of Inotuzumab in that patient population. So, of course, chemotherapy, conventional cytotoxic chemotherapy is really the backbone of treatment of patients with Philadelphia chromosome negative B-cell ALL. We know that Inotuzumab and Blinatumomab are both very effective in the relapsed refractory setting and are also very good at eradicating MRD. And so the goal of this study was to bring those agents into the frontline setting as early as possible to hopefully deepen responses, hopefully require transplant in fewer patients, and ultimately improve long-term survival rates. So the way that the study is designed is we give standard hyper-CVAD, but instead of giving 8 cycles of conventional chemotherapy with hyper-CVAD, we give 4 cycles. So we've decreased the total amount of chemotherapy from 8 to 4. And that's followed by 4 cycles of Blinatumomab, and then a maintenance phase of POMP maintenance alternating with Blinatumomab for about 1.5 years, as compared with the 3 years, which was historical. And then subsequently, after we enrolled 38 patients with that regimen, we amended the study and also added Inotuzumab given in fractionated doses during 2 of the chemotherapy cycles and 2 of the Blinatumomab cycles. So we've treated 62 patients so far, so 38 patients without the Blinatumomab, with hyper-CVAD, without Inotuzumab, with hyper-CVAD and Blinatumomab, and then another 24 patients with the combination of hyper-CVAD, Blinatumomab, and Inotuzumab. So far, in the overall cohort, all patients have responded. 95% have achieved MRD negativity by flow cytometry, so very high rates of deep MRD negativity. In the overall cohort, the 3-year overall survival is 84%, which is very encouraging compared to conventional chemotherapy. But what we're particularly encouraged by is the early data with the addition of Inotuzumab. So again, in those 24 patients, we have a median 1-year survival, but the 1-year overall survival so far is 100%, and there have been no deaths so far. There's been 1 relapse, but so far all patients are still alive. So we await for a longer-term follow-up, but this looks to be, so first of all, we were able to safely add the Inotuzumab into this regimen, and so far the survival data look very encouraging, and we hope to see these encouraging results maintained with longer-term follow-up.